Okay. The second speaker is Professor Bai Teo, the Dean of Public Health of the National University of Singapore. He will give his presentation on a system-level approach to COVID-19. Over to you.
Thanks very much, Professor Poa. So it's a pleasure to be invited to speak a little bit about the situation in Singapore and some of the measures that we've taken in Singapore. So I hope that you can hear me loud and clear as well as see my slides. So in Singapore, we were fortunate and unfortunate in some sense that back in 2003, we encountered SARS. And this was also another coronavirus that affected Singapore in a massive way, but it gave us the necessary insight into how we prepare the health system and the country for an outbreak of this nature. So when COVID-19 hit Singapore, the country was a little bit better prepared to handle this. And I will talk about some of the preparations that help. And specifically right now, the situation in Singapore, if you look at October, you will realize that we don't have many cases in the community. In fact, for the past 3-4 weeks, the majority of our cases have come primarily from importations, people returning back to Singapore. These are long-term work pass holders. These are students who are studying in Singapore. Some of them have been overseas during this period and they returned to Singapore with the infection. And so most of the infections that we have been seeing in the past 4 weeks, primarily from importations. In community transmission really has been less than 3-4 cases every day. So the situation in Singapore has been very well contained at present. But if you look at the epidemiological curve, you would realize very clearly that Singapore, our majority of the patients that have been affected by COVID-19 stems from migrant workers who have been contributing, working in Singapore, but they live in dormitories. And within a dormitory setting, many people are staying within the same room, and those are the environments that are very conducive for spread. Now, when COVID-19 first arrived in Singapore in January, the government responded very quickly and effectively recognized that the impact will go beyond health. And that's why the National Task Force that were assigned to look into this comprise ministers from different ministries. Of course, health is there, but education, trade, communications, national development, transportation, all of the elements that we are now very familiar with, the ministers were already convened at that time. So Singapore adopted a whole of government response from the very beginning. And that is necessary because if we look at what our knowledge of COVID-19 has changed over time, you would see in these 9 areas, from human to human transmission, all the way to the possibility of reinfection. Just about 4 to 5 weeks ago, we heard of the first 2 cases of confirmed reinfection that were confirmed through genetic tests. Our knowledge of COVID-19, its infection, the way it spreads, constantly change and evolve. And with those changes, our policies, our public policies have to change as well. If you look at the implications, trying to acquire natural herd immunity through exposure, it's not possible, and in my opinion, downright irresponsible. So clearly, countries have to start thinking about what is the long-term strategies to handle COVID-19. In Singapore, one of my colleagues, Professor Goh, will also be talking about the clinical response. But one of the lessons that we learned from SARS was the need to prepare not just the hospitals, but also the primary care sector for an outbreak of this nature. I talk about the preparation in the hospitals. So not many people would realize that in Singapore, the public hospitals conduct annual drills. And these drills no one knows when the drills will happen. It will be conducted in part by the Ministry of Health, where people will go into the hospitals with suspicious signs of respiratory infections, perhaps having traveled overseas. And those drills are meant to catch the awareness and the vigilance of our healthcare workers, even the frontline receptionists, manning the reception booths at the hospitals to see how alert they are to an outbreak of a nature like COVID-19 or SARS. Primary care has also been strengthened tremendously, both to protect the healthcare workers and also to manage infections in the community. So because of some of these measures that Singapore has put in place, lessons that we painfully learned from SARS, our healthcare workers, the infection of COVID-19 amongst healthcare workers is one of the lowest in the world. Right now, there are less than 10 healthcare workers that have been confirmed to be infected because they were carrying out their duties as a healthcare worker. I talk about the partnership with primary care. In Singapore, more than 80% of our primary care has been provided by private GPs, private operators. And during a national crisis like COVID-19, you need to have a way to bring in your private operators in a manner that makes it nationalized, that makes it a common platform. So whether it is charges, whether it is the number of days of medical leave, whether it is the kind of treatment that is given for the same symptoms, these are all nationalized. And we have a scheme called Public Health Preparedness Clinics. Again, useful lessons that we learned from SARS. And also, one of the key difference that I talk about Asia versus non-Asian countries, why Asian countries have done very well, is the ability to isolate all patients who have been confirmed with a COVID-19 infection. And that means that whether it is someone who is asymptomatic or who is just mildly symptomatic, we're not talking about those that have complications or severely symptomatic. Asymptomatic and mildly symptomatic confirmed cases are never asked to self-isolate at home. They are always quarantined away from the rest of the community in a field hospital or a government facility. This way, it helps to manage the spread. And I see this as one of the crucial differences between Asian countries that have managed to control this well versus non-Asian countries in Europe, in North America. And of course, many of the countries that have able to control and manage the crisis well have relied a lot on contact tracing. Singapore, like South Korea, has been quick to utilize technology, not just mobile technology, but also tokens that are given to the elderly to manage their movements. And one of the key importance of healthcare strengthening, really to make sure that everyone who's been infected will never have to worry about the cost of seeking treatment. And from the very beginning, Singapore promised that as long as you work in Singapore, you study in Singapore on a long-term pass, if you're infected, you will be eligible to full healthcare financing throughout your hospitalization care. Equally, I talk about Singapore experiencing importations. Up till today, our borders remain one of the strictest that there are in the world, and our borders remain closed. So by managing the people that are coming in, making sure that all people that enter Singapore are subject to a period of quarantine of 14 days for the vast majority of people, 7 days for those coming from well-managed countries. That's how we keep our situation under control. Of course, in this crisis, there's a need to mobilize manpower to help look after the vulnerable sectors. It could be nursing home, it could be the hospitals, it could be some of these community facilities that I talk about that are looking after asymptomatic or mild infection. And this is where we have been able to quickly redeploy some of our people that are well-trained, like for example, air stewards and air stewardess, very well-trained for hospitality tasks, and they have been redeployed as care ambassadors. Firstly, to look after patient needs, and also secondly, as ambassadors to remind people that during this time, you need to wear your mask, you need to practice social distancing when you're out in public. This kind of redeployment helped to increase the resilience of the health system and infection prevention and control processes. I talk about one of the major impact was the outbreak amongst the migrant workers. So at the height of it, all migrant worker dormitories actually have a dedicated medical post that were manned by people from the hospitals and from primary care. There was salary given to the healthcare workers even during the period of lockdown. Health insurance was provided. They were provided Wi-Fi coverage to make sure that they are still able to contact their family members and to stay in touch. So some of this matters a lot to make sure that the migrant workers continue to receive their salary and to maintain a degree of mental wellness. But of course, being isolated for a period of 4 to 8 weeks does create some strain on the mental well-being. The last point I want to highlight that is very different again in Asian societies versus European and North American society is really this need to monitor, to enforce, and to sanction people who don't follow the rules. In Singapore, there are very strict rules around when we are moving around in public spaces, we need to wear a mask. You can be fined if you are caught without a mask in a public space. Even when I go to the shops, I go to work, I need to register my presence through scanning QR codes. So this implementation actually helps to increase the degree of awareness and personal responsibility during a time of public crisis. And the government has been very quick to enforce and to mete out penalties for people who actually flout the rules. Restaurants have also been caught flouting some of these requirements. So there have been many discussions around the world talking about how we look at the number of countries look at the number of infections. But I would like to propose that looking at the number of infections per day is actually the wrong way to decide whether a country is able to handle this well. Because we've seen some of the European countries having very low case counts because they put in place severe lockdown measures. But the moment they lift some of these lockdown measures, we very quickly see an escalation of infection again. Right now, we see this happening real time in Europe as well as in North America. Really, I think countries need to start thinking about deciding what are the strategies that they should implement based on outcomes. And the outcomes really are this. I listed 8, but there could be more than these 8 outcomes. Amongst these 8 outcomes, I would actually think being able to protect your healthcare workers rank very highly in any country during a crisis like COVID-19. So in conclusion, I would just sum out Singapore's approach in these 4 points, that we continue to embark on very aggressive testing and contact tracing to make sure that we are able to quickly identify people who have been infected, identify people who have been exposed, and to quarantine, isolate these people away from the rest of their families, of their communities, to break transmission chain. The communications that have been given, not just to the public, but equally to the healthcare workers, and even to the policymakers themselves. It's very important in a time of crisis, just as we look at a whole of government response. When we start to think about the capacity to handle a crisis like this, it is not just about managing the demand, and this is where the people being infected, the type of people being infected, whether they are old, elderly with complications, but it is also about how you manage the supply of your healthcare workers or increase the resilience of your health system through field hospital deployments. And finally, all of the rules will not matter if there is no system in place to monitor, to enforce the rules, and to punish people who actually flout the rules. With that, thank you very much, and I look forward to some of the discussions later on. So with this, back to you, Kai Hong.
Yeah. Thank you. Thank you very much, YY. That was a very informative and comprehensive presentation.